In 2016, I had the privilege to attend my friend Taka's traditional Zulu wedding in a township at her childhood home. During this trip, I also got to see the beautiful seaside and walk along the Mhlanga Pier, both of these taking place just outside of Durban City. But I wasn't there for the wedding. I didn't know Taka before I left. I went to South Africa for my master's. While beautiful and full of amazing people and diverse cultures, South Africa remains to be one of the most inequitable countries in the world. And despite apartheid ending in 1994, racial segregation and post-apartheid legacies continue to create extreme inequities between white and Black South Africans. These inequities run along gendered axes, where in South Africa, 2,000 young women aged 15 to 24 will acquire HIV this week, and 2,000 will acquire HIV next week, facing some of the highest rates of HIV globally in a country that is home to the most number of people living with HIV in the world. Young women in South Africa similarly face disproportionately high levels of gender-based violence, including violence at the hands of their intimate partners. And research has found that 25 to 50% of all new HIV cases among young women in South Africa can be attributed to experiences of intimate partner violence and controlling behaviors. Young men who perpetrate violence, who hold harmful gender attitudes, who are controlling, also play a critical role in the HIV epidemic, as they are more likely to have multiple partners, less likely to use condoms, and themselves be living with HIV. Given the importance of gender dynamics, equitable relationships, previous research has begun to look at interventions to address these issues, including one called Stepping Stones, which is a 12-week program developed by women living with HIV in the UK and has been adapted for use in many settings and attempts to provide education and training to address relationship power dynamics. No behavioral intervention has been successful at reducing HIV rates in youth in South Africa. Why? Well, no one really knows, but one suspicion is the fact that rarely, if ever, do researchers, most often who look like me, white and from the global north, listen to the ideas and needs of young women. This is unfortunate, as South Africa has a rich history of youth-led movements, which has pushed forward social justice, and they account for 30% of the population, and at the end of the day, are the experts of their own lives. My first trip to South Africa originally was to attend a field school through SFU that was focused on HIV and youth. This was an amazing opportunity to learn alongside other students from sub-Saharan Africa and local experts and affected communities, and to be introduced to a study that was ongoing at the time. This study is Ayazazi. Aya, standing for adolescents and young adults, and Zazi meaning knowing themselves in Zulu, which is one of the country's most commonly spoken languages. Ayazazi encourages adolescents to inform, learn from, and participate in the research process, and is guided by a youth engagement framework designed for and with youth, recognizing young people's rights to participate in decisions that impact them and acknowledge the skills they bring to the table. In a research setting, youth engagement involves leadership that is able to see the potential and impacts of adults and young people working together. Through this project, I have been working with youth to develop innovative and youth-led knowledge translation and exchange projects, such as this video, which was used to talk about and get feedback from participants regarding results related to STI data, such as the differences between STIs and genital tract infections. This approach is being used in my PhD research, which focuses on measuring sexual relationship power and understanding youth's perceptions of measures used to capture power dynamics in young people's relationships. This work is asking previous Ayazazi participants about their thoughts regarding the scale measuring sexual relationship power. In health research, as well as other fields, we use scales to measure different constructs. However, this is done very often without critical examination into the validity of the measure and whether the scale we ask participants are truly capturing the construct of interest. Given that sexual relationship power, including controlling behavior and unequal decision-making power, are said to be important factors influencing the HIV epidemic, I'm trying to understand what young people think of scale items. So one example being, when my partner and I disagree, he gets his way most of the time. Using these interviews, we're trying to understand youth's perceptions. And also we're conducting workshops with youth advisory committees and previous participants of IAZAZI to understand data analysis and to support dissemination as part of my Public Scholars Initiative project, which will allow for better youth-informed critical reflections and feedback. Nelson Mandela once said, "Young people are capable, when aroused, of bringing down the towers of oppression and raising the banners of freedom." Youth need to be provided opportunity to be part of the process, where their feedback is valued, acknowledged, and they are able to participate in something larger than themselves. With youth engagement, a better understanding of important measures of gender equity, power in relationships, and violence, we hope to inform future youth programs and positive actions that seek to reduce experiences of gender-based violence among young women in South Africa and globally. Together, better evidence that is collected and analyzed by, with, and for youth can support programs that fit in the lives and realities of young people and ultimately can move us closer to the global goals of ending AIDS by 2030. So I want to thank all the young people who have provided their voices, who continue to work together with our research team, to all my colleagues here in Canada and South Africa, as well as the funders, including the Public Scholars Initiative, for supporting this work and making it possible during these challenging times. Thank you.